Welcome to From the Heights, a series of conversations with authors and thought leaders who will discuss the challenges of the time, offering actionable insights that you can use today. We will give you some strategies and ideas that will provide hope and will create the circumstances for transformation across the health and education fields. Hello, my name is Bronwyn Maiden. I'm an assistant dean at the University of Maryland School of Social Work and the executive director of Promise Heights, an organization that works collaboratively with over 20 other organizations and schools in West Baltimore to make sure that all of the children and youth in West Baltimore graduate from high school, college, and career ready. A few housekeeping details before we begin our series. This event is being recorded and is also being live streamed on our Facebook. Your attendance and participation of this event implies your consent for recording. Participant audio will be muted for today's discussion, so please feel free to use the chat box to share your thoughts, resources, and questions. Be sure to select all panelists and attendees in the drop down within the chat so everyone can see your questions and comments. If you're joining via Facebook, please post your comments, questions, and resources to the comments section. And following today's discussion, we will send all registrants a link to the recording, resources, and insights that were shared today in this session. And finally, if you need technical assistance viewing or hearing the audio during this event, please send a chat message to all participants, and one of our tech support staff will assist you. If you've registered in advance for continuing education units and have questions, just please email our CPE office at cpe@ssw.u, spell out Maryland.edu. Certificates will be sent directly from that office. We will be tweeting throughout this discussion, and if you would like to join us, please use the hashtags From the Heights and Dr. Satcher, and also tag us at Promise Heights. But we're really pleased today. This is the first From the Heights series that we're doing. And boy, we couldn't be more delighted and excited and proud to bring you Dr. David Satcher, who is truly an American hero and a treasure. He is one of the most widely known and respected physicians of our time. A former 4-star admiral in the U.S. Public Health Service, he serves as a Surgeon General of the U.S., as well as being the director of the Centers for Disease Control and Prevention before he founded the Satcher Health Leadership Institute at Morehouse College. At the core of his impact on public health, he is also a lifeline leader for civil rights and health equity. Dr. Satcher is the author of a new book, one of my favorite books, called My Quest for Health Equity, Notes While Learning and Learning While Leading. This book is available at local booksellers as well as Charm City Books right here in Baltimore. And then my friend Andrea Brown is the executive director of the Black Mental Health Alliance. She's a seasoned senior executive, and she served in several leadership roles, including at the National Association at the Advancement of Colored People, the NAACP. And in that role, she was the strategic planning, membership development, and training and oversight of many of the European branches. She also co-authored a leadership training manual for juvenile detainees, which is still used in juvenile justice facilities across the country. And actually, this is she's almost 1 year in her job as the executive director of the Black Mental Health Alliance. I'm going to turn off my camera and please help us welcome Dr. David Satcher and Andrea Brown. And thank you for joining us today.
Thank you, Rowan, for that, and thank you for the introduction and for your partnership. I see you, Dr. Satcher. I'm super excited. We're going to get you off mute in a second, but what an opportunity we have today to talk with you, glean from you, listen to you, get your thinking on race, equity, mental health, access, and care in a moment like this. And so let me say, I too have your book, gobs of highlights. And I have to tell you that the book is not only timely, but it's symbolic, rich, enlightening, and at times almost a little disheartening. And so, but yet we appreciate your drive and your vision, which provides us all hope in this moment. And so we are going to kick it off. But I think before I do that, I vacillated whether I should or I shouldn't, but since they said I could moderate, I'm going to put in a shameless plug. So just so you know, I have serious bragging rights among the ladies of Delta Sigma Theta, because they know now that I am interviewing one of the bros from Omega Psi Phi. And so I greet you from all the Deltas here in Maryland, at least. And thank you for joining us today.
Well, thank you. I'm delighted to be with you.
Yes, yes, yes. And so we are this is a conversation. And so there are many things on the hearts of people. You were just on an interview at WEAA on Friday. And so a lot of people got an opportunity to hear that. And still folk have questions. And so we're going to talk a little bit later about the Satcher Health Leadership Institute, and we'll talk about the great work there. But I really would be remiss if we didn't at least have the conversation in this moment about the coronavirus and now the vaccine. And so in your book, you lead with this gripping story about access to care. And almost 70 years later, we find ourselves at that same sort of intersection of race and access to care. It remains an issue. And I'd like for you to just talk a little bit about the collateral impact of COVID-19 on Black and Brown communities and its limitations to access and accessibility as we talk about the vaccine.
Well, thank you. I'm delighted. It was almost 20 years ago that we started to talk about disparities in health. And then in the year 2000, when I was Surgeon General, we came out with a report on Healthy People 2010. And we said in that report, of course, that there are certain things that we could accomplish by 2010. It was 2000 then, and we said that by 2010, we could deal with the issue of aging. We could give people an opportunity to age better than they had in the past. And I think we've made some real progress on that until, of course, COVID-19, which has really sort of set us back. But I feel very good about the whole process of setting goals. And there were only two goals in Healthy People 2010, the one dealing with quality of aging and the one dealing with eliminating disparities in health. We're not there yet. And of course, as I said, we've been set back by COVID-19, but at least we know where we should be going.
So that's fair. It's interesting that you say, that there was this plan in 2000, right? And, by 2010, certain things could have happened. And so we won't even talk about why we're not there, okay? We won't. But what I would like to do is, and again, I can appreciate, there's something to be said about a vision. And it's something to be said about the visionary. But I want to, if I could just go back to COVID just slightly, because you've heard people talk about the twin pandemics. So that's COVID-19, the coronavirus, and then obviously this what we see today and what we've seen over the last year, heightened racial tension. And so, so there are these twin pandemics, and yet I saw recently, and we've heard people talk about, when America catches a cold, the Black community catches pneumonia. And so, and that is not endearing when it comes to Black people and what that means. But what it does mean is that we've got to take a hard look at, the collateral damage done to Black and brown and other marginalized communities as a result of these twin pandemics. And so I really would like, as you move about the country via Zoom, and as you, I really would like your thinking about, the twin pandemics, and then, how do we meet the needs, the mental health needs that have come from both pandemics for in this moment, and especially in this moment. And, I hear people say, oh, but kids are socially isolated. There's fear, there's the elderly, there's access, there's the digital divide. So I'd love to hear your thinking about what we need to be doing, what we could be doing. And I don't know, maybe when you made your plan then, you had some thought about coming to this place.
Well, we released the first ever Surgeon General's report on mental health back in 1998. And we said in that report, of course, that we need to begin by eliminating the stigma surrounding mental illness. We need to change our attitudes, because just as things go wrong with the heart, the lungs, the kidneys, and the liver, things go wrong with the brain. They always have, and they always will. And therefore, there's no reason why we should allow stigma to prevent us from discussing mental health and mental illness. There's no reason why we shouldn't have ready access to treatment for mental illness. And that's where we've been struggling. We're trying to get to the point where people who need care can get it without shame. Stigma affects us in at least 4 different ways. It affects our attitude toward children. So we have parents who are very hesitant to even seek treatment for their children. And the reason for that, of course, is that they feel that the stigma of mental illness can do more harm to the children than they can do good to talk about it. But we tried to make the point in our book that we have to talk about it. We have to make sure that children get treatment as early as possible for mental disorders, and that we not allow stigma in the home, in the community, or in the school. We cannot allow that to prevent us from making sure that children get the care they need.
It's funny that you would specifically talk about children, Dr. Satcher. One of the participants has now asked, which makes perfect sense, is, and you've talked about stigma, and so we appreciate that, but was wondering, is it your belief that that the stigma around seeking treatment for mental health plays a role in the rising suicide rates among Black youth today? So I'd love to get your thinking around, do you believe that it's stigma related?
I do, because I believe that stigma is one of the things that prevent people from seeking treatment. And often if people had sought treatment for mental disorders, they would not have committed suicide. We know that from history. We know that today, that suicide is often related to mental disorders, and therefore when people don't seek treatment, they're more likely to commit suicide. So I do believe that there's a relationship. And we did a report on suicide prevention also, and we made that point in that report.
Dr. Satcher, you talked about, the 4 ways that stigma affects us. And could you talk about, you mentioned one, could you talk about the other 3, or at least bring them up?
Yeah, very important, I think. First, stigma affects the attitude of parents toward children. And the reason that many parents don't seek treatment for mental disorders in children, treatment that could, in many cases, make a big difference, is because they feel that other people knowing that a child has a mental health problem is damaging. I was talking with a pediatrician whom I've known for many years now, and she just retired. And she was telling me about the fact that she had a patient uh, a child who had a lot of problems, and she talked about the parents about the stress that was being put on the child, and they got very upset because they didn't want um, any discussion about stress because they saw that as mental disorders. So we've had a lot of history of having difficulty dealing with mental illness, early mental illness, late mental illness. And so parents often don't seek treatment because they don't want to admit that their child may have a mental health problem. Anybody's child can have a mental health problem. Anybody can have a mental health problem because just as things go wrong with the heart, the lungs, the kidneys, and the liver, things go wrong with the brain. They always have and they always will. The only question is, how will we respond?
And that's the big question. How will we respond? I know that you raise an interesting point about stigma. And, you know, some of what we are working on is how do we reduce this so that young people really understand that it's okay. So once we reduce the stigma, and we're not there yet. And there's another question in the chat that I think will be interesting. But as we start to talk about reducing the stigma, love, and we don't, again, I'm gonna park this, but really want us to talk about how we make sure that as we reduce the stigma and somebody says yes to help and to therapy, how do we make sure that they are in front of culturally grounded clinicians who see through a lens like they can, in a way to have a real understanding about trauma and race and how we didn't just wake up and get here. I mean, this is an ongoing part of a systemic problem. So, but I'm going to park that. But one of the interesting questions in the chat, someone has asked, as we understand millennials to be who they are, is it your thinking, or do you think that do you foresee the stigma of decreasing for millennials and generations behind them since they are becoming more open and more vocal about mental health?
Well, I would like to certainly think so, and I do think so. I think our reports contributed to some of the reduction in stigma, because there's been more discussion about mental illness in the last 10 years, maybe the last 15 years, than we had before. And we need discussion. I could tell you a lot of stories. When our first mental health report came out, I remember getting a letter from a young man who basically told me that he was very happy that we were talking about mental disorders, because he went on to say that his mother had died of a mental disorder, and he found out only after the report came out that she actually died from suicide. They had never discussed it. It was not something that was discussed in the home or the family. We're not going to solve this problem until we can discuss it. That's for sure. We've got to create an environment where people feel safe, that they can not only discuss mental health problems, but they can get treatment. That people get better every day from mental disorders because it was discussed and it was acted upon.
So you say, you know, again, everything goes back to messaging and having the conversation and about the dialogue. And so when we take the taboo out of it, based on what it sounds like you're saying, I do want to raise, as we are talking about, you know, mental health and about reducing the stigma and that kind of thing. I had a colleague we were in a meeting, I guess a few weeks ago, and one of the things that he shared was systemic racism as a public health crisis. And and he believes, until we, and again, we were just having this great dialogue about systemic racism and its impact on, obviously, on communities of color, but also on mental well-being. And one of the things he said is that, there should be this larger recognition of systemic racism as a public health crisis, because he believes that is at the root what we deal with in terms of our mental health. Love to get, and then somebody in the chat sort of talked about asking the CDC to make mention of a public health, not necessarily a public health crisis, but again, almost a 911 about racism and mental health.
I agree. I think more and more the CDC is trying to elevate the area of racism to the public health issue that it is. And they've had some difficulty with that. And some people have even left the CDC because they didn't feel comfortable raising the issue of racism. I think we're past that now, almost at least. And more people are talking about racism and how to deal with it. Certainly, the area of the CDC that deals with race and ethnicity has been very active in this area in the last 5 years and needs to continue to be so that we can make a difference in this area.
Thank you so much. Very robust. So you are generating quite a bit of commotion here, and one of the things again that you've answered some of it, but this I found to be interesting. And somebody asked, is parental avoidance of potentially being blamed, bad parenting, and engagement of social services also a factor that Black parents, the reason Black parents don't necessarily seek help? I don't know the answer to that, and I'm not sure that you do, but you may be able to speak to it.
Well, I think generally our attitude toward mental disorders is such that we're likely to end up...
Dr. Satcher, you're muted. You're muted, and I know it was good. You're muted, though.
I didn't know it was muted. It doesn't say muted on my screen, but can you hear me?
Oh, you can hear him. I can't. Okay.
Andrea, I can. Yes, this is Bronwyn.
Yeah, and it doesn't say that I'm muted on here. It says there.
Go ahead. We can hear. Everybody is saying they can hear him. Andrea, you can't. Go ahead, Dr. Satcher.
Andrea may have to. Why don't you repeat the question? Well, let me say a little bit more about parents, because I do think that parenting is really critical if we are going to make real progress in dealing with mental disorders. I think parents have to feel comfortable seeking treatment as early as possible for a child with suspected mental disorders, and have to feel that there's no shame in that, there's no blame in that. People are not blaming them when they talk about mental disorders in children. So the message that we're trying to get out is that mental disorders are common. Just as things go wrong with the heart, the lungs, the kidney, and the liver, they go wrong with the brain. They always have, and they always will. And the other thing that we've had to deal with recently, of course, is professional sports, especially football, and all of the players who end up leaving professional football and having mental disorders because they've had so much head trauma. We're working very hard now to try to make sure that we prevent that. I was very happy when the NFL decided to put people out of games if they intentionally targeted the head. I mean, the brain is special and it needs to be treated that way. And it's not a good sport to go around damaging the brain. So we need to do that. Just as we need to look at how we eat, we certainly need to look at the fact that we can do a better job of protecting the brain. Now, we could also talk about other sports, but I'll leave it at football for the time being, because I think there we've been heard. We are making some progress in reducing and preventing injury to the brain.
This is Bronwyn, and I'm going to kind of take over. Andrea,
Dr.
can you hear?
I can hear. I cannot hear him, but can you hear me at least?
Yes, yes.
Okay, wonderful. Then I'll go with that. I know when his lips stop, then I'll go to the next thing.
Okay, you go. Go, girl.
Okay, perfect. So, Dr. Satcher, thank you. What I know to have been a great comment, a great response. The chat is lighting up like nobody's business. And so, couple of things I just want to raise about. There are questions now about the traditional modalities in terms of therapy, right? And so, and one of the questions is, which I think is so powerful, are traditional training methods for therapists perpetuating stigmas that create barriers to seeking treatment in the Black community? And then how can training be improved?
Well, we have to be very careful here because, I mean, there are different training programs for therapists. And some of those programs I would salute as outstanding. Some of the programs need some changing. I mean, they need to be worked on so that we begin with the understanding that that mental disorders are real. And again, just as things go wrong with the heart, the lungs, the kidney, and the liver, they go wrong with the brain. Understanding that, we've got to be willing to provide the treatment necessary when there's something that goes wrong with the brain. We've brought this to a much earlier level. We talk with parents, even during pregnancy. Here at the Satcher Health Leadership Institute, one of the things we do is we work with parents who, during their pregnancy, need to know where the child is in terms of brain development. Very important. And so, what are the nutritional needs of a child? So, how are we going to make sure that the child's brain gets the nourishment needed in order to develop normally? We struggle with that all the time, but it's time for us to talk about it more. And I've been very pleased with how parents have responded when we raise the issue of, is the child's brain getting the nourishment that he or she needs? And if not, what changes do we need to make?
Thank you, Dr. Satcher, for that. I do want to get to another question about Congress and some funding, and then we're going to shift to the Institute, because I think it's important as we talk about leadership in this space, as we talk about how we pass the baton to be able to raise these issues. And so I just recently saw a chat about as Congress debates the cost of the COVID relief package. And somebody has said they think about what they've learned from you about the national economic impact, poor healthcare access, dumping our mental health and addiction problems into the community. Do you feel there's still an advocacy case to be made to the public and policymakers regarding investment in improving mental health access and other social challenges, such as the revolving door in the criminal justice system, is actually good for the national economy?
Most definitely. I think, and I'm good friends with the Kennedys, and especially Patrick Kennedy, and some of you know, but Patrick Kennedy and his father were very strong proponents of mental health care because he was an outstanding family, probably America's most outstanding family in some ways. But the fact of the matter is that they are providing leadership because they know how people are treated when they're dealing with mental disorders, even if you're wealthy. I want to make that very clear. Black people are mistreated, but also wealthy white people are mistreated if they have a mental disorder. So this is not a racial issue when it comes to the fact that we need to change our attitude toward mental illness. We all need to, again, remember that things go wrong with the brain every day in every community. However, of course, people who have the resources are more likely to get the treatment they need, and they can do that privately. But many Black people find it very difficult to seek and get treatment. And and often end up in jails when they should be in a hospital, end up getting sentenced and punished when the problem is a mental disorder that needs to be treated. We talk about that in the book, and hopefully we're beginning to make some progress, but we have a long ways to go in terms of treating mental disorders as a health problem and not a crime.
Makes perfect sense. Simply put, Dr. Satcher, as we begin to shift gears just slightly, I really think for those who have not had the benefit of reading the book, and it is a real benefit, would you just share a little about how we got to call you Dr. Satcher, right? If you could talk a little bit just about your story from childhood. And I think it's so powerful. And I think it's important as it shapes your vision and your passion for what you do. So talk to us a little bit about Dr. Satcher, who was a little boy, that Dr. Satcher, and how you got to want to be Dr. Satcher.
Yeah, I was very fortunate in many ways. I grew up in a home where neither of my parents finished elementary school, and yet they were determined that their children were going to get an education. And so we were all pushed at every point. When I was 2 years old, I came down with the whooping cough. And it was a very serious case of whooping cough. We had already lost 2 children in the family. But my dad knew the danger of this disease. So he went to town and talked with the only Black doctor in the town, Dr. Jackson, about coming out to the farm to see me. And Dr. Jackson finally agreed, and he came out there and he spent all day working on me. He warned my parents when he left that he actually didn't expect me to live, but that we should do everything we could to give me the best chance of surviving. And I think my parents did a great job. My mother stayed up all night, I'm told, and she even had to breathe for me at times. It was a whooping cough at its worst. Well, I survived. You probably figured that out by now.
I say.
And by the time I was 4 years old, I was telling everybody I wanted to meet Dr. Jackson. So finally, my parents agreed. They're going to take, for my 5th birthday, they were going to take me to town to meet Dr. Jackson. And of course, I never met him. Dr. Jackson died before that 5th birthday. So by the time I was 5, I was telling everybody I was going to be a doctor like Dr. Jackson. And that was sort of the beginning of it. I associated my illness and my recovery and Dr. Jackson's work with my future, that I had a responsibility to do for others what he had done for me. Racism was real, as you well know, in Alabama. It was real, and it was certainly as bad, if not worse, than it is now, back in that time. But I was able to persevere. We had segregated schools. We had to ride the bus more than 20 miles to get to school, even though there was a school less than 2 miles from our home. I could tell you a lot about, but you probably don't want to hear that story again because you've heard it. Racism is so much a part of our history, so much a part of our lives, but it's not an excuse for our giving up or giving in. We've got to keep this fight going. Now, you were asking me earlier about COVID-19, and I would just want to remind us that this is a disease that disproportionately affects African Americans in great part because of disparities in health. African Americans are more likely to have diabetes, more likely to get various forms of cancer, and so these things all go together. We have to eliminate disparities in order to survive diseases like COVID-19. I can say a lot about that, but it really pains me when I hear Black people say, I'm not going to take that vaccine because I don't know what it's going to do for us or do to us. But we know that Tuskegee was real.
Absolutely.
Some of you know that when I became director of the CDC, one of the first things that we did was to present to President Clinton a plan for a national apology for the Tuskegee study. And he did. I have a photo right up on my wall as to when the surviving members of the Tuskegee study, there were only 8 of them then, when they came to the White House and we had dinner the night before, and the next day, President Clinton issued a formal apology for the Tuskegee study. Tuskegee study was real. However, the Tuskegee study is no excuse for African Americans refusing to get vaccines today, because we have come so far since the Tuskegee study, which started, by the way, in 1932. So it ended in 1972. We've come a long ways, and we certainly cannot stand by and watch ourselves and others die because we refuse to take advantage of vaccines. We have many Black people on the front line of developing vaccines and providing access to vaccines. So it's time for us to really take advantage of all of the work that's been done by our people and others.
So Dr. Satcher, so here's what, I was coming, right? I see you wanted to start something. I can tell you wanted to start something, and you want to wait until we get we only have 20 minutes or so left, but I want to raise this with you, and respectfully, right? Respectfully, because I think that as we talk about the vaccine, still lots of issues about the rollout and the access. My mother is 79 with compromised health conditions, and she just had her first shot. So and was happy to get it. But, when we talk about Tuskegee, we talk about the apology, way too long and much appreciated, right? But what I will say is we don't have to go back that far to see disparity. Henrietta Lacks, here in Maryland, that may not be at Hopkins using her cells and didn't say anything. So there is real to me. And again, this is Andrea. There is, I get that we have to move past Tuskegee, but I think it's important to acknowledge that the medical profession have not always been super forthcoming or forthright and honest with communities of color about how we receive treatment. And so I just, so I hear you. I know that, it's frustrating.
Can we acknowledge that together?
Okay, acknowledge.
Yeah. So what do you do after you acknowledge it? I tell you what I did. I went to Morehouse, and then I went to medical school, and I became Surgeon General. I acknowledged that I had suffered from racism, but I didn't say that means that I don't want to be a part of medicine. No, I'm very pleased that I have been able to make a contribution to making medicine better. But you don't stand to the side and say, because this happened in 1932, I'm not going to take that vaccine. There are many African Americans involved in producing the vaccine.
Absolutely.
So the past is going to always be there. My past is going to always be there. But the question is, am I going to let that stop me from moving on into the future? And I'm
totally not. Fair. It's fair. And I will say, yes, the past is there. But I think it's important for us to remember that even in this moment, there's still issues about transparency, about what we have access to and what our counterparts have access to. And so I appreciate that. I could see he was going to start trouble. He was too cool in the beginning. I saw it coming. No, I'm giving you a hard time, Dr. Satcher. I do want to, as we start again, shift the conversation. So I think there are a couple of things that we can agree. And as I'm listening to you talk, I've written some notes about we obviously, when we talk about mental health and the Black community and many other public health issues, that there has to be this public education campaign. And so we message how we reduce the stigma. I mean, that's got to be the priority. But I want us to move a little bit. You talk a little bit about the three-dimensional perspectives of leadership in your book, and love for you to talk about who some of those leaders were that shaped you, and what that really looks like. And then how do we move from that place so that we make real impact? Because as you begin to not necessarily pass the mantle, I read somewhere that you were about your retiring. I thought that was a joke. I'm like, he's not going to retire. He's got too much to do. And so, but talk to me a little bit about the leadership.
Well, yeah, I appreciate that, because the book is about leadership.
Mm-hmm.
And all of the other things, as you say, the three dimensions. I talk about how I became a leader, and that's why the Hoop and Cup story is important. I talk about being educated at Morehouse and having the opportunity to sit at the feet of leaders like Benjamin Mays, Martin Luther King Jr., and others. And then I talk about my whole struggle as being the only Black medical student in many of my classes. And I talk in detail about how I dealt with that. I know that there are a lot of other people out there who are going through this every day. But I try to make the point that I never allowed that to stop me from reaching my goal. We have to see our goals as more important than the problem. And we also have to admit that things have improved. There are many white people who are out there on the front line fighting racism as hard as many Black people. We have to admit that. We can't just spend the rest of our time talking about the fact that there were racists around when I was a child. There are racists around now. But we've got to continue to keep the ball rolling. That's my only point. I'm not denying that racism is real. I feel very proud that I have survived it to this point. But I also am very thankful for people who, whether they were Black or white, have fought right alongside me. I've known some great white people who were committed to eliminating racism. And of course, we have a lot of them around now. So we've got to be honest about today versus yesterday versus tomorrow. And tomorrow looks much better than today or yesterday.
I read somewhere, I think someone interviewed you back in maybe October, maybe November. And I thought that this was so powerful. They asked you about the qualities of a potential leader and what an effective leader should possess. And your response, you talked about the Institute, but then you said you needed leaders who would first care enough. Then you said leaders who would learn enough, and leaders who would do enough. We need leaders who will persevere until the job gets done. I love the call to resiliency. I mean, that really is the call to action for leadership. And so, and again, that's not mine. That was yours. I'd love to have claimed it, but I'm
happy to share it with you. I love the way you do it, the way you said it.
But I think that is again the clarion call, and that number one, that we've got to make sure that we are committing to developing leaders and what leaders do. And so I think it takes us beyond, we recognize the conversation about the past, but we also figure out how do we go to the next level in the future. So thank you for, I've been saying it, it's written in something that in one of my planners, but I think that it is a powerful piece to hold on to.
Yeah, I'm glad you said that. It is a very important piece. And those are four very important qualities of leaders. Leaders need to care about the issues they're fighting for. Care so much that they're willing to sacrifice to make the right things come about. They need to know. There's no excuse anymore. We've got to know enough to be leaders. And then, of course, we've got to have the courage to do enough. And sometimes that takes a lot of courage, especially when you're in an environment, which is why I told the story about the times in medical school in which I was threatened to be put out of medical school. because of things that I fought against in school. So we can keep it up. Thank you.
So someone asked in the chat, could you, without naming any names, could you name an experience where racism just sort of shook you at the core? And I'm going to let you answer, but I was laughing about your twin brothers and how they heard George Wallace talk about Black folk not being admitted to the University of Alabama. And I thought that was so cool how they hid behind the bushes so that they're, so that they'd be able to say, okay, this is what he's saying. So I thought that was, I just thought that was such a cool way to, I mean, that, and in so many ways, that's like baby activism. So I love that. But the in particular, the participant has asked if you could talk about something specific to your growth and maturation, without mentioning names, something that sort of rocked you at your core in terms of racism.
Well, now some of those things are mentioned in the book, and I don't mention the names, but I talk about my reaction on the first day of OBGYN, and we went into the room to examine these patients, and to my surprise, all 4 of the patients were Black women, and they were not being treated with dignity. They didn't have, curtains and things like that you expect to see. So I walked out on the service because I thought it was inhumane. And the person who was over the service threatened that he was going to not only put me out of the service, but put me out of medical school and make sure I didn't get into any other medical school. But that's not the end of that story, and I like the end of the story. They sent me to the dean the next morning to be dismissed from medical school. And instead, he said that they had decided that I was right and that these patients were not being treated right, and they were going to change that program. There's a lot more I can say about that. That person, who was a Nobel Prize winner, later became a member of the board at Meharry when I was president there. And we really needed some help. Fred Robbins agreed to serve on the board, and he served on the board for 12 years. He died a few years ago. He was a great man, though. He was committed to Meharry as any board member we've ever had.
Awesome. Well, I'm glad that they decided what they decided, because it didn't sound like, and still doesn't, that you even had plan B. That was you were going to be what you were destined to be. I saw that face. Was there a plan B?
No, I'm listening to you.
And so just sort of walking in what you were ordered and called to do. So. And we get the benefit of that, quite frankly.
Let me say, I say very early in the book that my parents, who neither of whom finished elementary school, were people of great faith, and so am I. And so I had a plan B. I live with the plan B, but it doesn't depend upon what any man says, and so I am very pleased that my plan B was something that was beyond the control of men.
Powerful. So Dr. Satcher, somebody said in the chat, there are lots of questions, but folk are saying, God bless you. But somebody says, thank you for exemplifying velvet steel.
Thank you.
Velvet steel. And so how so befitting, velvet steel with a heart. And so appreciate that. I think we've got another question in the chat, and then we will close out shortly. Well, somebody asked, and they go back to, I know that we've started talking about leadership, and I want to go back to, I'll come back to this question before, but if you could talk about what your vision for the Institute in the next 5 years, what would that look like?
Well, let me just say that the Satcher Leadership Institute is about helping people to develop leadership skills. It's about working with people who really want to change things for themselves, for their children, for the community. And that's what the Satcher Leadership is about. We have already graduated over 1,000 people from the Health Leadership Institute. I'm very, very pleased with the fact that those people include young parents, many of them single parents who live in this community, and they have taken the time to go through our 12-week leadership development program. That's where they learn about the brain and the development of the brain of the child and things like that. So we have a long ways to go, but I'm very pleased that we have already been able to help people develop their leadership skills and to better develop their children, their child development.
Thank you for that. Somebody in the chat has asked, how does spirituality guide your leadership? And what I will say is, having read the book, it is clear you are a man of great faith. But I didn't want to answer for you. You talked about your parents' faith, you talked about yours, but just really curious about how they are curious about how your spirituality has guides now and has guided your leadership.
Yeah, as I talked earlier about how I grew up, and the only place we visited on a regular basis was the church. And my dad, who really I don't think had more than a 2-year education, became superintendent of Sunday school after my mother taught him to read. And he served as superintendent for 25 years. And then each of us had to read the lesson before we went. So we became very attentive to reading the lesson that was scheduled because my dad played such a big role. So here were two parents who didn't have much education themselves, who were determined that their children were going to have an opportunity to have an education, and who did the best they could when it came to things like reading and writing and basic stuff.
Awesome. Well, I think there are a couple of things, and I'm going to give you an opportunity to share anything else that you may want to talk about. I know that, again, lots of accolades in the chat. I have lots of folk are interested in the book. And so I know that the end slide will give people an opportunity. And again, you can see my notes and my highlights. And I think I read it in 3 days. And so and it didn't take me that long. It was a great read, but just felt your vision and felt your passion. But I do want to say this before I close and before just in case we get any last questions in the chat. And I just finished reading a book by Pope Francis, and it's called Let Us Dream. And this reminded me of you. So I want to just say this. And one of the things that he talks about, he's talking about the front line and some other stuff. And he said, they remind us that our lives are a gift. And we grow by giving of ourselves, not preserving ourselves, but losing ourselves in service. And so that was his quote. And so I want to say to you, you, my kind sir, have lost yourself in service. And for that, we say thank you. And so that is to you. I just, because this really is a life of service. That's what you have done. This has been your life. And so, and I love the thought that not preserving ourselves, but losing ourselves in service. And so as I listen to you talk about, the Satcher Health Leadership Institute and all the other things that you are still saying yes to, that is losing yourself in service. And so for that, I want to say thank you.
Well, thank you very much. Thank you for the great work that you've already done and are doing. I know enough about it to know that you are a star in your own right. And
we got work to do. Well, thank you so much. I think the last question that we can take, and with the back, and it comes from one of our participants. With the background of your work with the Clinton administration, what are some of the policy priorities you believe the Biden administration should have to address mental health needs in the Black community?
Well, the Biden administration's approach to the whole issue of health and healthcare is closely related to Obama and Obamacare. And I believe that Obamacare stressed mental health. They stressed preventing mental disorders in children, treating mental disorders when they show up in children. So, and President Biden had a lot to do with that. I want to make that very clear. He was on a team with Barack Obama. They were great teammates. And one of the things they looked at was mental health. And especially if you read Obamacare, and some of the things that are very clear there is that Obamacare provides access to mental health services. It's very clear. And I think President Biden is determined that people are going to have access to care. And he's committed to that. And I think we're very fortunate. We just need to support that.
Absolutely. So thank you. I think in a minute, I haven't gotten our last, so I've been pushing these questions. Looks like, okay. So closing remarks. Is there anything in closing that you'd like to say before our dear friend and leader Brown comes back on? Anything in closing?
Well, first I want to say thank you. Thank you for having me and giving me the opportunity to talk about my life, which is about which my book is about. And so I get energy from thinking that I have something to contribute to other people. I'm especially committed to young people. A lot of students have passed my way, and I hope that I can continue to contribute to the life and development of children and students.
Well, thank you, Dr. Satcher. Thank you very, very much. I know that you have many things going on, so we don't take it for granted that you were able to hang out with me today, and I get some bragging rights among the sorors. But again, it has, we appreciate the book because it is timely, and it is clear that we still have much to do. And so, again, I will close out with what I started when I said that thank you for losing yourself in service to others and to us. And I believe that they are going to, I believe Brown's about to come back on, but deeply appreciate you. They want me to show the book again. Yes, and I can show you all of my pages. So this is the book, and it is My Quest for Health Equity, Notes on Learning While Leading. And here are many of my highlights from the front. And from the back, I'm a voracious reader. You will not be disappointed. But and I believe Brown mentioned where it's available, but I think once she closes us out, she will tell you. But again, My Quest for Health Equity, Notes on Learning While Leading. This is a good read, and you don't want to miss that. So I'm excited that I had the opportunity to read it.
Well, let me just add one thing to that, and that is that my colleague here, Deborah Jones, would be happy to help you to get the book autographed. So if you buy the book and you send it, she will make sure that when you get it back, I will have autographed it.
Okay, so I'm going to send my book. I will make sure I'm going to send my book, and you will know it's mine because I've got writing all over it. Thank you very much. Okay, you heard it here. He cannot and will not go back on his word.
No.
Thank you again, Dr. Satcher. Thank you. Just stay tuned. I believe she's going to close us out.
Great to be with you.
Likewise.
Okay. So where does it say leave meeting?
Let's see. Thank you again, Dr. Satcher and Andrea. I really want to just mention very quickly, I know we're almost over time, that we really, in the book, Dr. Satcher makes it very clear. Leaders must take responsibility for making sure that individuals, families, and the community are appropriately educated about the nature of mental disorders. In addition, leaders must work to develop the kind of environments where people with mental disorders are comfortable seeking care and can find support as opposed to abuse. And we must educate and motivate the community to take appropriate steps. We must continue to try and better understand the nature of stigma, and especially the way it relates to culture. I want to thank you all for joining us for our first webinar from the Heights. We have another one coming up on March 15th with Dr. Lawrence Brown. We're going to talk about his new book, The Black Butterfly, along with Dr. Nadine Finnegan Carr from the University of Maryland School of Social Work. I really want to thank again our guests, Dr. David Satcher, as well as the wonderful and delightful Andrea Brown, the staff of the Institute for helping us with all the tech, as well as my great staff from Promise Heights. And remember, if you have questions about CEU, get to the University of Maryland, to our Office of Continuing Professional Education, and please join us Monday, the 15th of March from 3 to 4:30, again with Dr. Brown and Nadine Finnegan Carr, to talk about the Black Butterfly, the harmful politics of race and space in America. Until then, goodbye and stay well.